Welcome to Bon Secours. Bon Secours is a mission-driven organization. Our mission is to bring good help to those in need. That's what Bon Secours means, good help. Bon Secours is more than a business. It's a ministry. Our ministry started with the Sisters of Bon Secours, but is now carried on by thousands of co-workers who realize that working in clinics, home health, services to the elderly in hospitals can be, and is, more than a job. Bon Secours cares for people. We care for the persons who are sick, those who are dying, and others in need, persons who are poor and those on the margins of society. We care for the whole person, body, mind, and spirit, because that's how God cares for us. We believe people have dignity and deserve our respect. We show compassion to persons and families who are in pain and suffering. We care for each other as well as for our patients, residents, community partners, and clients. That's what we mean when we say it's more than a job. Working at Bon Secours calls us to serve others and each other. That's a special call. Not always easy, but always important. Bon Secours started in Paris in 1824 when 12 young women dedicated themselves to care for persons who are sick and dying in their homes. When news of their generous and compassionate nursing care spread, they were invited to other French villages and cities to nurse the sick and suffering and to teach others to deliver good help to the sick and the dying. Later, sisters went to serve in Ireland and England. In May 1881, 3 sisters of Bon Secours arrived in Baltimore and began to serve the sick and the dying in their homes. It's difficult to imagine, much less try to describe, all of the changes that have occurred since those 3 sisters and the hundreds of sisters of Bon Secours who later joined them began caring for the people in the United States. One thing that has survived all the changes and remained constant over the years is the sisters' belief that there is a God who loves each of us and that God calls us to minister to those in need. In 1919, the sisters expanded their ministry into hospitals, and many people came to serve with them. Some were Catholic, but people of all faiths and personal beliefs joined them. All people are welcome to bring good help to those in need. In 1983, the sisters started the Bon Secours Health System to carry on their ministry. Since then, Bon Secours has grown and now serves in many states in the eastern United States. Today, Bon Secours serves its communities in many settings: hospice and home health, ambulatory care centers and hospitals, nursing care centers, assisted living facilities, and independent living communities. In addition to these services, Bon Secours has outreach programs and community collaborations that promote health and social well-being, organized programs to provide more affordable housing, efforts to obtain insurance coverage for children from low-income families and for all persons who need insurance, a mission fund that each year spends over $1 million in a number of our communities to promote holistic health and well-being for people in need. Working together with the Small Business Administration, investing in small businesses in economically deprived areas, advocating for better health care for all Americans. These are all a part of caring for and serving the needs of the whole community. By reaching out and by living our values and beliefs, we work to influence the way healthcare is delivered. Today, you have to be a strong, well-run organization to be able to stand out in a very dynamic healthcare environment. Bon Secours Health System is strong and well-run. We're all proud of the work we do, but we also face significant challenges today. Advances in expense of new technologies, emergence of many new forms of convenient care, increased regulations, the restrictions of health insurers, new demands from our patients and residents, and from the public. We have to balance all these new challenges with our high standards of compassionate care and our belief that healthcare is a ministry, not just a business. There is another important challenge facing healthcare in the United States today to help persons who are poor and others who live on the margins of our society. What about their health and well-being? Their voices may be weak, their resources may be limited, but their numbers are growing. At Bon Secours, we strive to serve the needs of everyone in the community. We try day after day to help all people. We take this challenge very seriously. Bon Secours has always been and continues to be a part of the Catholic health ministry and an expression of the healing ministry of Jesus. It's a legacy which strengthens our present and serves as the base for our future. We want to live up to the teachings and promises of the Catholic social tradition. Beginning today, we invite you to experience what it's like to be part of something larger than just a job. We are an organization that is committed to the mission of bringing good help to those in need. We believe that the well-being of our world depends upon respecting and promoting the dignity of every person. We believe in being just and fair with people, and in recognizing and honoring our diversity. We believe one of the essential components of justice is to create and sustain right relationships among people. It is our mission to continue to care for the whole person so that everyone has a chance to reach her or his potential. Finally, we have to remain strong and viable in a changing world. What those first sisters of Bon Secours began in 1824 continues to live through every one of us. Everyone's job is vitally important. Each of us has the power to make a difference. Each of us is called and challenged to do what we can to make us all succeed. How? By learning and living the Bon Secours values, by supporting each other and caring for each person you come in contact with, by doing your job competently, no matter what part you play and what job you have, by making a conscious effort to improve yourself as an individual and as a professional. Bon Secours' greatest strength has always been its competent, caring, and dedicated people. You are now a part of that. Welcome to Bon Secours.